Assalamu alaikum, hello and welcome to The Health Show here only on the Islam channel with me, Alistair Greener. Every week we're joined by a health expert within their specialised field who discusses prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, we offer an alternative viewpoint from our health experts who attend the show, and they're here to help guide you in the right direction. If you'd like any further information on our programme or any of the topics that we discuss, then please do get in touch at healthshow@islamchannel.tv. Now, today we're looking at cancer and the support available to those who suffer from it. MACMILLAN Cancer Support is a UK charity whose ambition is to reach out and improve the lives of everyone living with cancer and to inspire millions of others to do the same. From the organisation, we're delighted to be joined by Dr. Tanya Anastasiadis, MACMILLAN's GP and facilitator. She's a great advocate for people living with cancer in Tower Hamlets, East London. As a GP facilitator, her role focuses on improving other GPs' understanding of cancer services and encourages them to challenge and reflect on their own practices, from screening right through to survival. Thank you so much indeed for coming on the show. I think we're going to have a lot to talk about today.
Oh, thank you for having me.
It's great. But before we talk more to Dr. Anastasiadis, we're going to first watch a short animation which explains exactly what cancer really is.
What is cancer? Cancer starts in our cells. Cells are tiny building blocks that make up the organs and tissues of our body. Each cell has a control centre called a nucleus. The nucleus receives signals from the body to say when the cells should divide and grow and when they should stop. These molecules can work inside the cells or on their surface. The nucleus then tells the cell what to do. Usually cells divide in a controlled way to make new cells. When a cell is no longer needed or can't be repaired, it gets a signal to stop working and die. Sometimes the signals go wrong and the cell becomes abnormal. The cells keep dividing and making more and more abnormal cells. These cells form a lump called a tumour. Not all lumps are cancer. Doctors can take a small sample of cells from the lump. This is called a biopsy. They will look at the cells under a microscope. This will allow them to examine the cells and decide if the lump is cancer or not. We're getting better at recognizing and treating cancer, so today many people with cancer can be cured. Even if a cancer can't be cured, it can often be controlled with treatment for months or years. Your doctor or nurse will talk to you about this. For further information or support, call us free on 0808 808 0000 or visit macmillan.org.uk.
That was fascinating to see that in real layman's terms exactly what cancer is, because it has a stigma almost that people don't really want to talk about it because people are really frightened of it, aren't they?
Yeah, hugely. I think different groups of people have different maybe misconceptions or ideas about why they might have it, how they got it, what they can do about it.
So let's talk a little bit about the real basics of cancer.
Yeah.
First of all, the different types, how common it is, and who's more likely to get it. Let's start off with the types of cancer, the most common.
I mean, there are hundreds of different types of cancers, and each different country has a different range of cancers that appear more commonly. For instance, in the United Kingdom, we're looking at breast cancer, colorectal cancers, and lung cancers. I think it's a really interesting question as to the causes of cancers and what we can do about them. Sometimes the cause isn't known. Sometimes people are genetically predisposed, but there are lots of things that people can look at and review in terms of the risk factors and what they could possibly do to lessen the chance of them getting cancer and also their recovery, actually.
Okay, so let's start off with just general things that are maybe good habits to do that will hopefully give you a better chance of not getting it. What are the sort of things that we should focus on?
I mean, what I say to a lot of my patients is there are some things in life we can't control, like our age. We're all older today than we were yesterday, but there are some things that people have formed bad habits, mainly smoking. I mean, smoking is one of the biggest, most preventable risk factors we can look at altogether. General health, so there's clear evidence that obesity is linked to some forms of cancer, and actually reducing your obesity lessens your chance of developing some cancers, like bowel cancer again. Other things like physical activity, and also diet, what we eat, and the things we could do that maybe could help us reduce those chances again by what we're actually doing on a day-to-day basis.
Are there certain foods which are particularly good for us and particularly, maybe bad for us when it comes to the chance of getting cancer?
Yeah, I mean, I think it's interesting. There's a lot of information out there. I think we should all be asking ourselves, where's the evidence? And it's very clear that fruit and vegetables, high fibre diets are good. Red meat, probably in moderation, and looking very carefully at all the processed foods, the foods that have got maybe preservatives, things like processed burgers, or any of the processed meats, in terms of moderation is key.
For most people, obviously hearing from their doctor that they've got cancer is an enormous shock.
Yeah.
How do most people find out that they actually have it? Are there telltale signs that, will lead someone to think, actually, something's wrong?
Yeah, it's interesting. I think, people say cancer doesn't knock, and sometimes it's not clear. Sometimes there are obvious things that are happening, and people know their bodies better than any doctor will ever know. And I think if people are concerned, they're seeing things appearing, they're seeing skin changes and mold changes, or they're finding they've got lumps where they didn't have lumps, or they're developing symptoms that they didn't normally have. There's lots of guidance out there for professionals, but it's not always that straightforward, and people can have lots of different symptoms. So I think if you're worried, you need to go and speak to a health professional and share that worry you've got.
So basically, if you see anything that's different about your body from what you used to,
It's like I say, you know yourself better than I'm ever going to know you. If you're worried, particularly about developing something new, but there are some telltale signs that are obviously much more worrying than others, like weight loss, loss of appetites, but there are some more subtle symptoms as well. That's why I encourage most people to come and discuss it with somebody and share that concern.
One of the things I know that you're very keen on is for people to get screened. Tell us a little bit about what exactly screening involves, how you go about getting yourself screened, and for that matter, when you should get screened. Is there a certain age or something?
Yeah, so I think there are screening programs around, and I think it's worth saying that different countries have different screening programs, but also even within the United Kingdom there are slightly different ages, but essentially in the United Kingdom there is 3 different cancers we can screen for: cervical cancer, colorectal cancer or bowel cancer, and breast cancer. And depending on those different screening programs, you'll get invited. You need to be registered with a GP, you'll get an invitation through the post to have something which will hopefully, the idea is it will pick up the cancer early enough for it to be curable. And we're noticing, especially across London, the take-up of screening is getting quite worrying in some areas. People are not coming forward for screening, they're not partaking in it, and it's something that you could actively do as an individual to try and minimise that risk.
I know that's a particular issue within the Muslim community, isn't it?
Yeah.
That there seems to be sometimes a culture of, we will work this out ourselves as a family, as a community, but obviously this sort of screening is absolutely essential. What are some of the concerns that maybe people within the Muslim community have about coming to see a professional about screening?
I mean, I think it's interesting. I think it's the Muslim community we can learn a lot from in terms of learning, but each community has their own reservations and concerns. I know, for instance, that it's difficult often if there's no female GP for a female patient to come forward with the concern she might have. There are often more practice nurses that are females within practices, so I would always encourage people to present, even if they can't get to their male doctor, have a chat with one of the female practice nurses if that's their way in. I think, like all things, there are taboos within society and communities. Talking about your bowels, your bowel habit, let alone being asked to send a sample in the post is quite a barrier to some people. And I think it's about breaking down that barrier and enabling people to understand why it's so important.
And again, it's the fact that this is such a confidential matter, is the fact that it is a very private thing between you and your doctor or GP or health specialist.
Yes. I mean, I think, all of these conversations you have are very confidential, but I'm also trying to get communities to talk within themselves about why they might be worried about going forward or taking up that screening, what they think might happen. And for instance, a lot of the stuff that we do with the Macmillan Cancer Supporters is give that information around what it might mean to go and have these tests done, as well as all the stuff you can get in terms of support around treatment.
Let's talk about a bit more now about Macmillan, because you get very much involved as soon as someone is diagnosed. They are told that they have cancer of one form or another, and maybe an outline of treatment is given to them. when would you normally get involved, and how would people find you and start the conversation?
I think the thing about Macmillan Cancer Support and the strength of the organisation is it's available to everybody. There are different ways of accessing information. I encourage all my patients right at the point of diagnosis, when they've just been told, I give them either the helpline number, which is a free phone number, or I make them the web address. It depends on that patient, their literacy, their understanding. Macmillan's done a lot of really good work in terms of trying to make leaflets easily understandable, but also in a host of different languages. We have leaflets that are in Arabic and in Urdu, over 14 languages. For also those people who maybe don't read, there are also audiobooks through the website. And there's information from everything really, from what that cancer is, all the way through to financial support, emotional support. There's even information on there about how you can help your loved one with cancer. So often, carers don't know how to support.
So for anybody who's got any concerns, we're going to give the phone numbers later on. So if you want to know the numbers to call Macmillan, we will give you that a little bit later on in the show. But so have a pen ready and waiting. But for anybody who just gives you a call, immediately you're going to get through to someone who will then guide you to the best way of helping you.
And it's also important to say that when you do call, say which language you'd prefer, because what we're trying to do is accommodate different people from different areas. The idea for Macmillan is that we try and reach everybody, and some people are harder to reach. So yes, absolutely. Calling through, you'll get met on the phone with somebody hopefully that you feel like you can communicate with, and they'll signpost you also to within the organisation people who have specific areas, especially like for instance legal advice or work advice or psychological support.
One of the things that's interesting is that you obviously hear everything and you've heard every scenario in the book. What are some of the misconceptions that people have about cancer and cancer support?
I think it's a very good question. I think that people are living with cancer now. We're having an increased number of survivors. I think still within certain communities, the C word, the cancer word, to many still is quite fatalistic. I'm going to die. There's nothing anyone can do. It's all over. These sort of deep-seated, but now obviously every type of cancer and the stage you get the cancer has a different outcome. But I think some people think there isn't anything that can be done, and there is increasingly more that can be done.
As a matter of interest, do we have a statistic roughly of how many people actually survive, and go into remission from cancer?
I think survivorship at the moment, we're looking at about 2.5 million people in the UK, and that's set to double in the next few years. So we're going to look at 4 million people who are survivors. And the thing that I teach a lot of GPs or health professionals about is actually surviving doesn't always mean surviving well. And Macmillan Cancer Support is there to help you live the life that you want to lead with that cancer, and how you can go about that and retaining your control over your life, things like that. You
said that it was going to double. Yeah. What's going to be the main initiator of that? Because that's quite a striking statistic.
Yeah, it is. I think as a nation we're all getting older, and age is a risk factor for cancer, but also treatments are improving. The idea is we're trying to pick up cancer earlier. The earlier you pick up a cancer, the higher your chances are of surviving, and that's not always very easy, either for patients to come forward or for when a patient comes into me, that GP recognising it.
Actually, let's have a look at that, because again, somebody might be a little bit fearful, thinking, OK, I'm going to another professional. Yeah. It's not my GP who I've known for years. I'm now going to somebody else. Give me an idea of that first conversation that you're going to have with a patient. What are the sort of things you're going to discuss?
I think fundamentally the most important thing is to empower people to come in and actually say what they're really worried about. It's not easy. In the UK particularly, we have 10-minute appointments and consultations. It's not that I'm defending my peer group, but often if something doesn't feel right, please go and speak to somebody. If the response you get still something doesn't feel right, go back. I say to clinicians that I know 3 strikes and that patient's in. They're into something, either into a second opinion or into a test. There's a reason why someone's come in and made an appointment, and we need to sort of flush that out. Saying that, you might get referred on to check it's not cancer, and to be honest, quite a lot of the time, it's not cancer, But it's really important to sort of establish that relationship, and if you can't for some reason, because I know sometimes it doesn't happen so easily, is do go back, do seek advice another way.
And for people who do come to see you, obviously you can talk through the various options and treatments, and that will be dependent on the cancer, of course. Yeah. But what are the typical options? You know, people often think about, you know, having some really invasive surgery, and that obviously brings its own fears.
Yeah, I think actually, you know, it's incredible the sort of range of treatments and how specific they can be for different cancers. So surgery might be an option for some, but not another. There may be radiotherapy or chemotherapy or hormonal therapy. You know, the list is very, very long, and you know, we've got some incredible specialists whose sole job is just to figure out exactly how to combat those cell changes and how to sort of provide a treatment that is either curative or, like the video said, stall it or stop it.
We're going to talk to one of your patients in the second half, and we'll talk to her a little bit about attitude and, you know, this thing of remaining positive. And it seems a bit counterintuitive to, you know, people say, stay positive and it'll be great. How much do you help people with their frame of mind when you consult with them?
I think that's why there are organisations like MACMILLAN Cancer Support, because you need time. You need people who are trained to know how to provide that support. And again, to establish what really are the anxieties or the impact that cancer's had on that patient. And it's so variable. You know, some people, it has direct impacts on their family life, on their future planning that they want to do as a family, financial, job. I think the key is actually getting them to engage with an organisation that has that resource of support. And it can be from the minute they're diagnosed. It's not waiting for a problem. Information for me is power for patients, and I think that's what the organisation is extremely good at, actually.
You've touched a little bit on the various support mechanisms that you provide. People will have undoubtedly seen the logo, the green and the white of MACMILLAN. If you had to sort of sum up what it is that you do, how you feel about the support that you give, what would you say?
I think that we're trying to support everybody. Okay, at that point when they've been diagnosed, and to tailor-make that support depending on what they need, whether it's practical, emotional or financial support. I think that actually, you know, it's worth bearing in mind that MACMILLAN's organisation it's a charity, and it's, you know, we have to actually sort of acknowledge that we're very, very grateful. The 98% of the funds are raised through people actually donating something, and I think without that, none of this would have been possible really as an organisation.
And so many people, as with Helen, who we're about to meet in a while, are people who have survived, who have come through the process and actually have become your greatest advocates. Yeah,
absolutely. And it's through them also that we're learning as an organisation where we need to provide greater support. How do we connect with communities that maybe we aren't connecting as well with? You know, and I think, you know, it's a growing organisation, and London, like the UK, there, you know, with lots of different populations with lots of different needs. And I think it's about meeting those needs for those patients.
There will be quite a few people who will have been very grateful to MACMILLAN in the past for the help that you've provided. And I know there's a tremendous amount of fundraising that you actually do. As you said, 98% of your funds comes from charitable donations. Tell us about some of the events that you do, because there's so,
my goodness,
there's so much.
Yeah, so much I do, but the people that are around MACMILLAN, I think there's everything. We've got the one that's carrying on at the moment is the MACMILLAN Coffee Morning across the country. People have done treks, you name it. You know, there's a variety of ways organisations, individuals have all contributed somehow.
There's no typical patient that comes to see you. How could you allay people's fears that, you know what, I've heard it before, don't worry, I'm going to be able to help you? Maybe some of the more obscure stories perhaps that you've encountered.
I think that, you know, I think it's about the professional that you're seeing, and I do say to patients, you know, this is my day job, this is what I do day, and I talk about things, lumps where you might be embarrassed they may be, examinations that you wouldn't, you know, you might be fearful of having. You know, that's my bread and butter, that's what I do. And I think also it's about saying, tell me what you're really worried about. You know, let's talk about that first. Let me try and allay those before sort of more of a gung-ho approach. I think everyone's an individual, and I think it's about listening, I think.
It's interesting hearing you, because there's this wonderful air of positivity, but obviously we do recognise that many people don't survive cancer, so therefore it must be tremendously draining on your emotions sometimes when you're involved in this. How do you stay positive and upbeat about everything?
I'm not always positive and upbeat. I think we've all got patients that, you know, I've gone home and I've gotten really upset and I've cried. I've learnt more from patients than any textbook, and I think it's the interactions with people who've got days or months or years where actually as a medical professional, You know, you gain something from them and it lasts. You know, I've learned a lot from some of my Muslim patients about end of life and what people feel is important. So I think we're all growing in this, and I think we're all learning from each other. I think what's key is that we share that learning within communities, increase the uptake of screening. You know, GPs and doctors need to teach one another about the learning they've gained from different patient groups.
And the other thing, actually, just coming to the screening thing again for a second, you talked earlier on about having screening and some of the things that some people might feel a little bit uncomfortable doing, but how important it is. And of course, there's one group of people who are not traditionally terribly good at going to the doctor, and that's men.
Yes.
And prostate cancer is a big issue for men. What sort of screening process do you recommend for them? Do they go, is it a case of going to the doctor every 5 years for a checkup, or what's the sort of process for them?
Well, in the United Kingdom, there isn't a specific prostate screening programme. So the important thing about screening is that it's evidence-based and that we're causing more good than ever causing harm. What I encourage, especially men to do, is actually, when you know something's not right, for instance, with prostate cancer, symptoms of your pattern of going to the toilet, for instance, if something doesn't feel like it's quite right, come, talk to us. There are blood tests we can do at the right time to give us an idea of whether you need further tests or not. I think it's about actually, you know, biting the bullet and going and seeing somebody and sharing that.
And I think one of the biggest things to really make people realise is that you are a charity, you will see anyone, and it's free.
Yeah, so the organisation, I mean, I work with the National Health System as a GP. The organisation MACMILLAN itself is absolutely, it's a free support service, and it's for everybody, age or community background.
And we're going to meet one of those people in the second half of the moment. Thank you very much indeed. And what we should say, though, is we must stress that should you suffer from any medical problems or have any health concerns, please, it is always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. As I said, it is now time for a short break, but don't go away, as when we come back, we'll bring you a story of a remarkable patient who didn't only suffer from cancer, but multi-forms of cancer over the last 15 years. And we're going to hear how she's now helping others to fight their fears. See you in a moment. Welcome back to the Health Show, where our topic today is cancer support. We're joined by MACMILLAN Cancer Support, a well-renowned charity helping those diagnosed with cancer in the UK. In the first part of the show, Dr. Anastasiadis gave us a great insight into supporting those with cancer. And we're now joined by a lady who isn't just a survivor, but a survivor of multiple cancers. Helen, it's great to have you on the show. Thank you for joining us.
Thank you.
And we'll talk to you in a little bit. But first of all, I'd like to give you a few statistics. As you may have heard earlier on in the show, there are now 2.5 million people living with cancer in Britain today. And as we also heard, by 2030, there will be over 4 million. MACMILLAN Cancer Support wants to ensure that every one of those patients has the support they need and that no one has to face cancer alone. Let's just take a look.
The C word. For a long time, it meant a death sentence. But the story of cancer is changing. There isn't just one cancer, but over 200. And there's no one cure. So finding all the answers is going to take a long time. But we're getting better at diagnosing it earlier, and treatments are improving. So while some people will sadly still die of their cancer, today more people are living longer with it, or being cured. But the fact is we are all living longer, so more of us will get cancer in the first place. There are 2 million people living with cancer in the UK today, and that will rise to 4 million by 2030. Equivalent to everyone in Leeds, Liverpool, Bristol, Birmingham, Belfast, Edinburgh, Cardiff and Plymouth. When you're facing cancer, it can feel like you've lost control. MACMILLAN is here to help you take it back. Whether it's a nurse being there from the moment you're diagnosed, a helping hand with your everyday chores, advice about money worries, or just someone ready to listen when you need to talk. Cancer isn't going away, but we can all help make sure no one faces it alone by donating or volunteering, campaigning or raising money in whatever way you choose. Together, we are all MACMILLAN Cancer Support.
Well, welcome back to the show, both of you. And one of the things that I really enjoy from watching that video is, first of all, the direct language. It's very plain, simple language, but also the tremendous amount of hope. And that's what, obviously, Macmillan is really all about, isn't it?
Yeah, they are. They're about hope and they're about support and reaching out and making sure that we touch as many people as we can and give them that.
And one of those people is Helen. And Helen, you've just got such a remarkable story. Just give us an idea of what you've been through.
Well, I was diagnosed first of all in 1991 with bowel cancer, and since then I've had 5 other cancers, and I've also learned that I have a genetic mutation of a gene which predisposes me to cancer.
Now, that's an interesting thing, this predisposal to cancer. You talked about that before, didn't you, about how some people are or aren't. Is it a way of knowing whether you have that predisposition, or is it just one of those things?
I think there are ways of finding out, depending on what you've presented with. We all know people who've got family histories of breast cancer and carrying the breast cancer-specific gene. In Helen's case, it's more of a rarer syndrome, but again, genetically can be found if you're a carrier.
And if you are aware of that, are there special screenings that you can do accordingly?
Yeah, definitely. I think there are also special clinics that look at the genetics of families and making sure that other family members are tested. But also you're much more eligible to enter screening programmes far earlier to make sure.
And we've certainly heard of celebrities who've taken quite drastic action to prevent this actually happening to them. But coming back to you, Helen, to have gone through so much, you say all the way back since 1991, I mean, that's quite a journey. What kept you going through that journey?
It was a case of having to. I had a 2-year-old son, and I needed to keep my life going I wanted to see my son grow up. And when I first started out, there was very little support. But as time went on, Macmillan came more into the forefront, and I joined Cancer Voices, and I then got into touch with other people who had cancer. I was able to discuss that with them. And the support from the other people, the support from my health team, and also knowing that I had this genetic fault meant my son and my rest of my family could be screened.
And for you, you actually converted to Islam a while ago. How has that affected your belief in yourself and the way that you've approached your condition?
Well, Islam has made my life a lot more calmer and more organised, and I've learnt that our bodies are a gift and we have to learn to look after our bodies, and we do the best that we can. And everybody's given their own skill sets. The doctors, the surgeons, the support groups, they're all given their skills to help us, and we should be reaching out and taking every opportunity to get our screenings done, to find the help, to get the information and take advantage of the support that's out there. You have this amazing attitude, but I'm sure there's been times when maybe they've told you yet again there's something going wrong. When you first heard it each time, how did you manage to deal with that news? Because so many people watching will have gone through that position where they're at the doctor's surgery and they get that news. What was your coping mechanism at that point? My coping mechanism was trying to set myself goals. I mean, each time I was told it was like another sword had descended. And yes, I have my black moments. I have, like everybody else, I have times when I feel very depressed about it. I wake up in the night with panic attacks. But there are so many new treatments out there. There are so many support groups. Nowadays, you can find information about you can go to Macmillan's Cancer Support. They have people online, they have forums, they have leaflets. You don't need to go through this on your own. And I used that fact that I had these people that were there to support me. They don't only support me, they also support the caring mechanisms around me, my families, my friends, who sometimes I think have a harder job than actually the patient.
It's an interesting thing you say that, because so many people, it is the family and friends around someone who has cancer who actually feel that they want to be able to do something but just don't know what to do. And then it comes up that conversation. How do you have that conversation? Should we talk about it? Should we not talk about it? And you give a lot of advice in that direction as well, don't you?
Yeah, there is advice. I mean, it's worth saying as well, we've mentioned websites, but there's also a lot of support centres, and those support centres aren't just there for the cancer patients themselves. They're based in hospitals, they're based in other organisations, some community settings, and There are people there you can go and actually talk to on behalf of being a carer and just saying, how should I go about this? I'm worried about this. How should I bring it up? And like I said, there's lots of information there of tips, that we've learned from people telling us what's worked, what hasn't worked.
I'm also particularly impressed by the different forms of help that you actually offer, and one of them is the funding that Macmillan do of different services. Tell us a little bit about that.
Yeah, I mean, it's the organisation funds health professionals, people like me as a GP, nurses as well, but also other community organisations. They also work in partnership with existing organisations and other sectors, help with lobbying, for instance, around government legislations as well, and giving support to that. So there's a wide range of support, from funding particularly maybe some GP time, all the way through to the information leaflets we've seen.
How did you find out about Macmillan in the first place, Helen? Because it seems now to us so almost natural thing to do to go and see Macmillan because their name is omnipresent. But for you back in the day, how did you find out about it? And tell us a little bit about that first interaction that you had.
So when I very first had my bowel cancer, Macmillan wasn't an organisation as such, it was Cancer Backup. And it was a helpline. So you phoned up the helpline. The hospitals were not in the process of giving out leaflets and things, and there was no, as far as the surgeons are concerned, the information they gave you was what they wanted to give you. They didn't necessarily tell you everything that you needed to know. As time went on, the internet, the wonderful World Web, turned up, and we were then able to get online and to start accessing. And in the process of Googling, we all know about Macmillan nurses, and Macmillan nurses, I think, are probably one of the most famous Macmillan cancer support people that everybody knows about. But I went for Macmillan nurses to see if there was anything there that I could find, and I then came across a group called Cancer Voices. And Cancer Voices is an online forum where you can go and meet people that have had cancer, people that are waiting to get treatments. You can talk to people that are caring for people. So it's for everybody, and you can go in and you'll always be able to find somebody who'll be able to relate to the experiences that you have. From there, I got involved with giving out leaflets and helping to talk to people and doing things like this, hoping to get out and help and give some more support to people that are going through the same journey that I've had.
And of course, everybody, as we've discussed already, is very different. Their cancers are very different, but their approach will be very different. And it's quite interesting that for you, being on forums really helped. And I'm guessing there's a lot of different ways that people can interact with Macmillan, whether it be on a one-to-one basis, a very private, very personal basis, or something a little bit more open, sort of doing runs and sort of announcing to the world that you're there helping Macmillan.
I think one of the things Macmillan does is it links people. So I know, for instance, I can only speak for the United Kingdom, but if you put your postcode in onto the website, it will automatically spring up with things that are going on around you. So sometimes it's not directly Macmillan support, but the linkage they provide with things that are going on locally. So I think linkage and support takes all sorts of guises, and I think it suits different people at different times.
And talking of different times, were there any pivotal times for you, Helen, where actually it was almost a lifesaver that Macmillan were there for you? Were there particular moments for you when it was really important that Macmillan were there to support you?
Yes, because I had been told that I had Lynch syndrome, which meant I was open to all these very different cancers. And I felt totally isolated. It's a very rare condition. And I didn't know anybody else at all in the whole of the country, the whole of the world, who had this same thing. And by going on to Macmillan, I actually found on Cancer Voices one other person who had exactly the same as me, and she also had felt totally isolated. We're now very good friends, and we've now managed to sort out support groups. We have Facebook programs, we have other support groups where we meet up, and we've managed to make a lot of other people feel that there is somewhere to go and that they're not the only people with this.
There's often great comfort with that, isn't there, when you realise you're not alone.
Yes.
And actually you don't have to go through those sort of awkward conversations with people, because actually here's someone who's experiencing the same as you. And what is it about this of psychology of that really does seem to help us as human beings, do you think?
I think it's, like you said, it's that you're not on your own. I think people feel very vulnerable when they've been given a diagnosis, and there is, I would say, historically, a huge information void, and like-minded people you can talk to and engage with, and just, I suppose, normalise it, would you say? And actually, you know, having had some of these treatments are not very easy to live with and beyond, and there is consequence to these treatments and ongoing support that you need. And I think just hearing from other people that they too are suffering, even though they've had the treatment for the cancer.
And I like the way you say normalise, because actually that does help an awful lot when people realise, actually, this isn't something that's completely unusual. I mean, you talked a little bit earlier on about friends and family. Have your friends and family engaged with Macmillan Cancer Support as well? And what sort of things have they got out of it?
They have spoken to other people who acted as carers, so they know the ups, the downs. They've learnt different ways of coping. For example, whether to speak about it, whether not to speak about it, whether to cry in front of the person, whether not to cry. And they've been able to exchange views and ideas with other people. So again, they're getting the comfort and the support, and they're learning that what's necessarily right for somebody is not unusual, and it's right for somebody else. So they can also go on there and they can find more information about the actual disease itself, so they know what to expect. They can find information about the chemotherapy and the side effects. So when I'm snapping at them, they can know that that is because, A, I'm not feeling very well, rather than me just being stroppy. And it helps them to deal with it themselves. It's very, psychologically, it's very hard for the person who's caring for somebody. I've had it from both sides, so I know from both sides how hard it can be.
And you talked there about connecting with other people, and for, again, people watching, you know, who maybe want to connect with others within the Muslim community, of course, finding people who actually understand the faith implications of the condition and knowing what to do and how to discuss various matters, that must be hugely beneficial.
It is. I mean, in my own masjid, the ladies there, one of the big things that came across was the barrier about going to see a male doctor, and I explained to them that the medical teams are skilled and they've been given that gift to be skilled. You can always get a chaperone. You can take your husband, as it says that you're allowed to do. You can take your sister. You can take somebody with you, and also that to take the help and to get your body back to the way it is what you should be doing. You should be taking advantage of the screenings. The screenings are there to help you, and it's going to help your life and help you and your family.
One of the things that, you know, you talked there about Macmillan nurses, and funny enough, my neighbour was a Macmillan nurse, so I was very aware of the house calls that she did, because for a lot of people who are maybe, we talked about being an ageing population, they're elderly, maybe housebound, that level of support of someone coming to your house must be a great comfort.
Yeah, I mean, I think it's you know, the Macmillan support, in terms of health professionals, a lot of them are nurses within the hospitals. I mean, like you said, everyone remembers the Macmillan nurses towards maybe the last years of someone's life, the last months or the last days. I think it's as important to sort of bring what already is in existence together. And I think actually there's a lot of support in communities, and I think one of the Macmillan's strengths is actually meeting those communities as well and engaging with them, and working together is really key, because not one organisation can cover everything.
There is a huge amount to take on board, and I can imagine for a lot of people when you first hear it, it's almost overwhelming. What advice would you give to people to be able to actually, you know, see through all of that and not feel this overwhelming bombardment of information? How do you keep some form of perspective?
I think the first thing you need to do is you need to make a list of questions. You need to know exactly, and take somebody with you is one of my biggest advice, because when you go in and you're given this information, you won't always take it in, and there will always be things that you need to ask later on. And don't be scared of asking questions. No matter how much your doctor may try, your consultant, I didn't mean GPs at that, sometimes consultants can come across as being a little bit abrupt, but make sure you push for the information. The more information you have about your condition, the better armed you are and the better forewarned. But also remember that it is okay to be scared. It is okay to be worried, but to take advantage of all the support groups, networks, your family, your GPs, the nurses, and to go to Macmillan Cancer Support. They can answer practically every question. They've given me help with financial information. They helped me understand my rights of employment and getting back to work. They have helped me psychologically just by talking to me in the middle of the night. They're a fantastic team, and I would suggest they would be your first port of call.
I know, obviously, you're not always going to be as positive as you are, but to me, it's so impressive that you have this incredible attitude. Would you say what we're seeing with Helen, is this sort of typical, this highs and lows and the different ways that people have with it? How common is it for someone to present in the way that Helen's coming across?
I mean, I think, Helen, you're pretty unique. You've had more experience than the average patient would have done, but we were talking about it earlier, and everyone's experience of any cancer at any stage is incredibly unique, and it affects people in a very unpredictable way. And I think emotionally it's a really tough journey, and you can have good days and bad days, and sometimes you know why you're having a good day or bad day, and sometimes you don't. There's also a huge vulnerability and the unknown, which I know that a lot of the richer picture stuff we've done with MACMILLAN is actually trying to figure out, beyond 3, 4, 5 years after your diagnosis, there's a lot of impact still. There's a lot of psychological issues that we've barely scratched the surface of with support. So as an organisation, we're about sort of looking forward and beyond that first consultation you've had where you've been told how can we support you going onwards when things creep up on you, don't they?
Well, actually, let's talk about the future. First of all, Helen, we'll come to you in just one second and talk about your future and how you're feeling and how you are right now. But what about the future for MACMILLAN? What are the sort of things that you're working with at the moment? We've heard a lot about the different areas that you offer support. Yeah. What other things are you working on? Where are you particularly focusing on at the moment?
I mean, I think there's a lot that anyone can do, and I think actually the figures that are quite daunting is this survival. And being able to reach out and support those survivors in the ways that they need. So I think as an organisation, we're keen to sort of evolve and meet those demands and needs, and they're great, and they're big. There's a lot of people affected in different ways.
And for you, Helen, looking at the future, obviously your perception and your view of the future becomes very, very different as soon as you've been diagnosed. How do you deal with looking into the future, and how far do you look, and how do you sort of get your head around all of that?
I set myself goals. So when I first had cancer, my son was 2. I wanted to see him go to primary school, then I wanted to see him go to secondary school, then I wanted to see him go to uni. And I set myself little goals. And sometimes they're very big goals, sometimes they're small goals. But I take each day as it comes. If I don't feel particularly happy, I try not to introvert myself, but I try and just accept that is because of my psychological fears about it. But I know that the future is a lot brighter than it used to be. And cancer used to be called the big C, still is. And I hate that term. I really hate that term. I much prefer it was the big S for survivorship. And going forward, there are new treatments all the time. We have fantastic screening programs, and if people just get out there and take advantage of what they have, the future is far. You're saying about it being daunting, that there are 2.8 million people out there. I don't find that daunting. I find that fantastic, because there's a lot more people surviving than there were years ago. And to me, cancer is no longer the automatic death sentence that it used to be. There is hope for everybody.
Have you done anything since you were diagnosed that first time in terms of, have you changed your lifestyle? Have you adjusted anything at all that you think might have actually helped you overcome each different cancer?
I've changed dietary-wise. Mind you, my diet has changed with different treatments. My diet has changed differently according to different regimes. So I probably don't eat as much red meat. I try and eat lots of fruit and vegetables. I try to exercise more, try and get more sleep. But generally I just try and be more positive.
And how are you today?
I'm fine.
That's great to hear. And it's one of the things that I do love the fact that a lot of this stigma seems to have gone. Is there much more work to do with removing stigma of cancer, do you think?
I think there is, actually. I think there's preconceptions amongst people, amongst certain groups, amongst doctors, amongst GPs. I think there's a lot of work that could still be done. I think actually there are people that still think it's quite a fatalistic diagnosis, and that might be why they're not coming forward. I'm not saying that everyone does survive, but increasingly things are looking up. it's more just encouraging people to come and to speak about it and to get the information and to share what their concerns are.
That might be your big sort of message today, but I'd like to finish off today with people who are watching who may have loved ones with cancer or at a different stage of their journey. What final message, very briefly, would you like to give to anybody watching who's concerned about the topic we've been discussing today?
I think my biggest one is that you're not alone. And, you know, there are people, there are professionals, there's Macmillan Cancer Support for you and now, at this point in time. That would be my biggest take-home message, I think.
And Helen, what would you say?
I would echo that, but I would also say that there are a lot of people out there who can help you, a lot of people who can support you, and take advantage of it. And I'm proof. I'm still here all this time later, and if I can do it, anybody can.
I love the fact that you're still here and you're maintaining this incredible positive viewpoint. If you could give advice to somebody who is maybe in a particular low moment, which you've admitted you have been in yourself, what would you say to them to lift themselves up, to actually see things in a little bit more positive way?
Have a look in the mirror and look at, I was told by one of my surgeons that my scars for my cancers should be seen as medals for having survived a very big battle, and that everybody is stronger. You're a lot stronger than you think you are. And to just talk to somebody. If you're feeling down, you're feeling miserable, talk to somebody, talk to your mum, talk to the cat, talk to anybody, but talk to somebody.
Great advice. It's been really inspirational and actually just really, really useful as well. So thank you so much indeed. Life with cancer is still life, and Macmillan will support you to help you live through it. Right from the moment you're diagnosed through to the treatment and beyond. They're a constant source of support, giving you the energy and inspiration to help you take back control of your life and feel more like yourself again. That is the Macmillan ethos. And if you or anyone you know is suffering from cancer, then please do get in touch with Macmillan Cancer Support for free information here in the UK. The phone number is 0808 808 0000, or you can visit their website www.macmillan.org.uk. I would like to thank my guests today, Dr. Tanya Anastasiadis, and of course Helen, for coming into the show and sharing personal but really important and helpful advice, especially Helen for that remarkable story. It's been really inspiring, and I hope it's going to also encourage anyone else out there with cancer to reach out and get the help and support that they need. As Helen said, you're not alone. If you'd like to find out any more information, please do email us again, healthshow@islamchannel.tv. If you missed any of the numbers, give us a call. We'll let you have them. Once again, we must stress that should you suffer from any medical problems or health concerns, it is always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. Again, thank you so much indeed for coming in. Thank you very much indeed for watching. It's good for me and for my guests. See you soon. Assalamu alaikum.